Greetings, and welcome to Myasthenia Gravis, making the most of your doctor's visits. This is a patient program put together by the Patient Learning Center of the Patient Helpline Foundation and Patients Rising. This slide is a disclaimer. Essentially, you can read this at your leisure, but none of this is medical advice. This is just guidance. We have learning objectives here. The first of 3 learning objectives is to improve healthcare literacy. It's my belief, and Patients Rising's belief, that patient empowerment begins with knowledge. And a basic understanding of key terms that are used by your medical providers will make conversations between you and your providers more effective. A second learning objective is understanding and using the tools of this particular program. Now, we've developed worksheets and guidance designed to help you record your symptoms, treatments, and the impact of your disease on daily living and quality of life. And we've done this because this is the information that doctors need to make educated decisions in your care, and it's also the kind of thing that eats up a lot of time at doctor's visits. The third learning objective is making the most of your doctor's visit. So this program is going to review how to prepare for, how to be present for, and how to follow up after a visit with your doctor. Okay, so this is me. I'm a medical assistant. I'm a board-certified patient advocate. I'm a writer by trade. I've done a lot of teaching and instruction, and I've been working with patients literally since I was 10 years old. My mom made me a candy striper, which is a volunteer, at the nursing home where she worked. And I've had a long career since then in just about every kind of healthcare situation you can imagine, including clinical trials and working at Patients Rising to help develop patients' advocacy and communication skills. The key to healthcare literacy is getting comfortable with a lot of the terms that you hear. Now, where this class is taking place online, there's a file section over on the side. You go to that section at your leisure, and you'll find a glossary of healthcare terms there. So if you can understand the words that are coming from your doctor or in a test result or report that you see, it increases your practical knowledge, which improves your ability to communicate with the people making decisions about your care. Knowledge and improved communication leads to greater empowerment for you, and that greater empowerment, in turn, leads to more satisfaction in your health interactions. It can even result in better outcomes. And you're more engaged in the process of making decisions about your healthcare.
Hi, everyone. My name is Vanetta, and I live in Westchester County, New York. And I am honored to be a part of this important discussion on healthcare literacy. When living with myasthenia gravis or any chronic condition, understanding the language of healthcare is not just helpful, it's essential. Your doctor's appointments are short, and every minute counts. The more you understand medical terms, test results, and treatment options, the better you can communicate with your healthcare team. Healthcare literacy is not just about knowing big medical words. It's about making informed decisions for yourself. It's about confidently asking the right questions and understanding your treatment options. It's about advocating for your needs. One thing that has helped me, and one thing that I encourage all MG patients to do, is keeping a simple glossary of terms you hear often. This way, when your doctor discusses something like Mestinon or a thymectomy, you're not caught off guard. Instead, you can focus on the conversation and what it means for you. I also can't stress enough how valuable it is to ask questions. If something isn't clear, ask for an explanation. Say, can you explain that in a different way? Or how will this medication affect my daily life? These small steps lead to a better care, better outcomes, and ultimately a more empowered you. Remember, knowledge is power. The more you understand, the stronger your voice will be in your healthcare journey.
Our second objective is understanding and using the tools that have been built to help make your visits more impactful. We want to be able to help you prepare for your doctor's visits using an online form that tracks symptoms, how your disease is impacting your daily life and your quality of life. And it becomes a form that you can print or download and you can add to your patient portal or bring in with you to see your doctor when you go to see your doctor. Now we're going to watch a short video here. This is just showing you how the form works. You're typing in your information into the form, and when you're done, you will receive an email with a copy of the form. Only the things that you filled out, things that you left blank, will be removed for organizational purposes. And that's the form that you'll be able to save as a PDF that you can add to your online medical record or that you can take with you to hand to your doctor. Now, the medication tracker is another worksheet that we've created for you. It's an online form. It's a Google Sheet. Very simple, very straightforward. It helps you track your medications with the dose and the frequency, when you've started, when you've stopped them, and you can print and download that and bring it to your doctor. And this is what that form looks like with a sample that you'll see there. You'll be entering in your drug name based on what's on the medication bottle, what you use it for. Do your best there. I mean, it might be for migraine, it might be for movement disorder, it might be for difficulty swallowing, whatever it might be for, okay? Then track your dose, pull down menus for frequency and the time of day that you take it, and whether you're still on it or if you've stopped it. So let's move on to the third objective, and that is making the most of the visit. So we start with before the visit. Preparation is key. So before your visit, you should be using these worksheets that we just looked at to make sure that you're bringing updated information with you to your doctor. It helps you organize your medical records. You should look at your online portal or whatever recent test results you have. Make sure that you look at these things before you show up at your doctor. I know this sounds like extra work, but remember, when you sit down with your doctor, the studies have shown that people only get 17 and a half minutes on average to sit down in a doctor's appointment. That is so little time considering how much time myasthenia gravis occupies your life. So we have to make the most of those 17 and a half minutes. Part of that is going to be visit prep.
Hello, my name is Denise Trombley, and I hail from the scenic state of New Hampshire. I'm really appreciative to have this opportunity to share some of my experience with you. I was diagnosed nearly 11 years ago, and since then I have learned a lot. And how to prepare for your doctor's visit is really, really quite critical. I learned from the beginning to keep notes. I have a notebook, and the workbook provided by this organization is very helpful as well. Keep a note about how you feel, what seems to help, your response to various medications, some life circumstances that may have occurred that you would like to address with the doctor. Other doctor's visits, that's really important because you can't assume that all of the doctors are on Epic, which is the software that some hospitals share. So keep notes about that. Look at the worksheets. Make a list of questions that you want to prioritize with your provider. Assume that this is a dialogue with a partner in healthcare. That is really, really important. Understand that you are part of the process. So keep good notes. Make sure you list questions between visits. That's so important. and really make sure that your relationship with your provider is comfortable and you can share information.
Now, I've worked with a lot of doctors and I've been present for a lot of consultations. And I can tell you that some of the most sought after doctors in the world will sit there and talk about baseball for 10 minutes and then say, oh, your blood test was this. I think we'll keep you where you're at. See you next time. That's not a doctor's visit. So during your visit, you got to start with whatever your primary concern is. Got a new symptom, the worsening of one, you started a new medication, it seems to be creating some kind of complication. Your doctor is an expert, so use that expertise with your primary concerns. You're a stakeholder, you're a partner in this. So you really need to understand what's going on. It's not fair for you not to. And make sure you ask open-ended questions. So what's an open-ended question? Well, here's a close-ended question. Do I have to take this medication every day with food? The only potential answers to this really are yes or no. You want to ask open-ended questions. How should I take this medicine? You can't answer yes or no to that. It's going to prompt an explanation of how you should use the medication. Open-ended questions are a great tool for good communication. If you want to really learn something from someone, ask them open-ended questions.
Hi, my name is Alicia Piconio, and I was diagnosed with myasthenia gravis back in 2016. And so I've attended my fair share of doctor's appointments over the years. And doctor's visits can be nerve-wracking and stressful, scary, and oftentimes rushed, as you have been waiting months to see your doctor and you often have a short time frame to actually meet with your doctor, and a lot needs to be covered. Today I'm just going to talk to you about some ways to make that appointment better, to make it more efficient time for both you and your doctor. Something that I started immediately when I got diagnosed was I started keeping a notebook. I keep a note in my phone, and I note symptoms that I've been having. I keep track of different things that I notice, questions that I may have. That way, when I go to see my doctor, which is every 4 to 6 months, I have information with me that I can remember, oh, I need to ask the doctor about this, or oh, I've noticed this trend, maybe it's something that we need to look into further. And having that notebook is just pivotal, because then I can also write down notes while I'm in the appointment of what the doctor is telling me, of any follow-ups. It just really helps me with that. Another piece of advice I would offer is if you are having trouble with communication that day, like let's just say you're not being able to speak well, or you're having brain fog, I highly recommend having a family member or a personal friend who knows your situation come with you to the appointment. This takes some of the burden off of you. That way, if you can't communicate well or you're just not following what the doctor's saying, they can help clarify and make sure that you're there, but also that they can just be there for support, which is so often what we need as we struggle with chronic illness. Last thing I would recommend is make sure that you summarize with your doctor at the end of the appointment any action steps that might need to be done before your next appointment. Do you have to have labs done? Are your medications changing? Are there things that just need to be done before you meet again that you want to make sure that you note? And then if your doctor's office provides aftercare summaries, my office provides me a printout and an email copy of what was discussed at my appointment. I always review that to make sure that I didn't miss anything or I don't have questions about something that was noted there. That's just been a really helpful thing for me. And so if your doctor's office offers an aftercare summary, I highly recommend reviewing it. Like I said, these appointments are oftentimes rushed and stressed, and they don't have to be that way. They can be a pleasant experience if you prepare well enough in advance.
Okay. Now let's put our Legos together and build the castle. We're going to put everything together because you're done with your visit, and now what? So this is a good time to review your notes. Make sure that your health records are now up to date. If you just got a prescription for a new medication and you filled it on your way home, put it in your medication log. And schedule your tests or follow-up right there on the spot. When you have a chronic or rare illness, you can't afford to lose time. You're doing yourself a favor. Present you is doing future you a huge favor, so that when future you becomes present you, you don't look back at past you and say, damn, I wish we had done that before.
Hello, my name is Alexis Rodriguez, and I was diagnosed with myasthenia gravis 27 years ago. I live in Atlanta, Georgia. I'm going to talk to you about what to do after your doctor's visit. Well, it is super important that you review your notes. Are there any medication changes, any new treatments? Update your health records. We need to make sure that all of our records of changes, treatments, etc., are not only in their portals, but any time that you use like bracelets with medical IDs, that you update your health records of any potential changes. Also, while you're there at the doctor's office, go ahead and schedule any type of test that they may ask you to do, any type of blood work or any scans or whatnot. Make sure that you do that while you're there. Any follow-up, if depending on whatever your cadence of meeting with those doctors are, go ahead and schedule it. I always say, if it's not on the calendar, it's not going to happen. And of course, begin your plan for your next visit. Take the time, organize yourself, organize your thoughts, write them down. That way you won't forget them while you're there at your next visit with your doctor. The more organized we are, and if you need a second pair of eyes, have somebody to go with you, and I encourage you to do that. 4 ears are better than 2. So take the time, plan, and make sure you're ready for your next doctor visit.
Okay, let's wrap this up. You've heard from some amazing myasthenia gravis patients, advocates in the space, who have shared their personal experiences, learning the provider's language for better communication, using tools to prepare for your visit, staying focused on what you want during that visit, and reviewing and following up right afterwards. Double extra secret bonus tip now. Okay, you ready? This is exciting. Okay, there's a place where you can find other people who understand your journey. Find and join your nonprofit support organization. If there's a myasthenia gravis nonprofit that you find, make a relationship with them. Why? Because other people who have this incredibly important thing in common with you gather there, and you can share their wisdom, the lessons that they've learned. You can get tips on doctors to go see. There's so many benefits to being part of your community. And there are nonprofits out there doing really good work, working hard, dedicating themselves in ways it's hard to imagine sometimes. If you don't know how to find one, you can start by searching Myasthenia Gravis Support Organization or Myasthenia Gravis Support Groups, and then the plus sign and adding your zip code, because that'll tell you things that are close by to you geographically. I hope this has been a really good experience for you. I want to really thank the myasthenia gravis community, because the people who've stepped up to review these materials, the doctors who've looked at these materials, all for the purpose of making your doctor's visits more impactful, more successful, more satisfying. Okay? The people in this video, there's been so many people who've contributed to this. And I thank you so much for taking the time to learn about this program, and I hope you use it to great effect.